Hello, good afternoon, everyone. As Lord Trees rightfully said, dengue is the most widely and rapidly spreading mosquito-borne viral disease in the world. And as recent, fueled by climate change, rapid urbanization, population growth, evolution of the virus has taken a new turn. And with the evolution emerges new variants and serotypes of dengue, and which in turn has led to massive outbreaks in countries like mine in Sri Lanka. With a 30-fold increase in global incidence over the past 50 years, more than half of the world population is at risk of dengue infection now, and is predicted to increase about 60% of the world population by 2080. Each year, an estimated 390 million infections occur around the world, resulting up to 36,000 deaths. So as the regional epidemiologist of the city of Colombo, I'd like to share a bit of my experience that I had during my tenure in Sri Lanka in Colombo. So this is the city of Colombo. It's a highly dense, highly population dense city, and we have been battling with dengue for the past 15 to 20 years. The city has a special task force dedicated to plan outbreak control and seasonal clustering, but our numbers remain the same or is increasing as we speak. Dengue has a seasonal transmission in Sri Lanka, and with two peaks occurring with the monsoon rains in June and July, and October and December, respectively. The majority of cases occur in June, July, and the summer monsoon for the past decade, and 2017, as you can see, was critical for us. Our healthcare system was overburdened, our hospital beds were filled, our children were sick, and our pregnant ladies were also having diagnosed with dengue. So the city of Colombo contributes to the national dengue statistics with an incidence of 299 persons per 100,000 populations, while in the whole island, the incidence fluctuates about 190 per 100,000 population. That is quite a large amount. And as hard as we try to handle this outbreak with national strategic plans for dengue, the currently available public health measures and community engagements cannot make much effect of the numbers that the cases are being reported. Sri Lanka has stepped up by establishing a special dengue control unit and a presidential task force. But there has been great progress in disease surveillance, clinical management, and vector control. National guidelines with enhanced available diagnostics have significantly improved the clinical management of dengue at the rate, but reducing the case fatality rate about to 0.2%, which is a record low in the Southeast Asia. However, sustaining this momentum is a challenge. As you can see in this slide, even with COVID in 2019 and 2020, we had some reported cases, but as Colombo Municipal Council, where the dengue is always controlled, our annual health budget in the whole city of Colombo spends 25% of its money on dengue and its surveillancing. And as you can see, the dengue hemorrhagic fever increases maternal death by 450%, and it was the first cause for maternal deaths in 2017 when we had the outbreak. And it also includes fetal complications, stillbirth, preterm delivery, and fetal distress and miscarriages, which we all have as a consequence of high incidence of dengue. And the changing epidemiology has not been helping Sri Lanka either, because at this moment of time, we're experiencing nearly 300 cases per 100,000 population as we speak of today. So the importance of an integrated approach is really important right now. And as a country who has been battling with dengue for the last 10 to 15 years, we know our ways of clinical improvement, but vector surveillance and community engagement is not enough as yet so far. We direly need a treatment solution. We direly need a proper diagnostic method in order to find out and treat dengue patients. Here you can see in 2017 how our hospital setup was surged with dengue patients. Our problem is who to treat, who will develop serious complications, and how to treat, how to prevent serious illness. It's always a problem when it comes to dengue, and it's overwhelming our healthcare systems. The overwhelming numbers of admissions and the severe burden to the healthcare system that the world saw in COVID-19 is faced by dengue endemic countries on seasonal basis. And the fact that dengue being restricted to the tropics and the subtropics is not actual anymore. Dengue pathogens often move with people, and with result of climate change and rapid urbanization and population growth, the migration of dengue has expanded its horizons and is going to reach and will be a world problem soon. Innovation for climate change sensitive diseases such as dengue should be a collective effort, and no single country or an organization can address multiple aspects of discovering, developing, and ensuring access to new healthcare tools for climate sensitive diseases. Collaborative approaches with endemic countries and in the lead to ensure the development of new healthcare tools from bench to bedside is quintessential. So that's where the Dengue Alliance comes. DNDi, the Drugs for Neglected Diseases Initiative, along with the key partners, have established Dengue Alliance to work on joint projects to progress preclinical investigations for potential dengue treatments. The Dengue Alliance members coordinate efforts to help overcome knowledge gaps and expedite clinical research and regulatory approvals, including addressing unmet needs for diagnostics. The partnership also focuses on raising funds and mobilizing resources while openly sharing research knowledge. The partners of this alliance are the Transitional Health Sciences Institute in India, Ministry of Health in Malaysia, the Sri Raj Hospital Faculty of Medicine in Mahidol University, Thailand, and the Oswaldo Cruz Foundation, Fiocruz, and UFMG in Brazil. The partners of this alliance work day to day to order to deliver treatment, and the Dengue Alliance is initially embarking on finding suitable antiviral drugs and host-detected treatment by repurposing drugs, and the work is progressing well so far. So the dengue strategy is what Sri Lanka needed, and I think the rest of the world who is battling with dengue, is to correctly identify the patients with dengue. So we need proper diagnosis and identify who need it most. So to risk stratify, because at the moment of time, we have so many patients who might develop serious dengue complications, who might not. And we have no way of knowing who that would be without a proper biomarker to predict it. And to treat and prevent progression of severe disease, we need effective drugs. And that is what the Dengue Alliance is actually working right now. So to wrap up, research and development for dengue treatment and diagnosis should be included in infectious diseases funding and policy priorities. Availability and equitable access to tools to diagnose and treat climate-sensitive diseases are a key part in building resilient communities and health systems. Biopharmaceutical innovation for vaccines, diagnostics, and treatments thus needs to be a core part of climate change adaptation strategy. The UK Global Health Framework brings together priorities for research and development, climate adaptation, and ending preventable death. The UK government should make the links between them and prioritize research and development for climate-sensitive diseases such as dengue. Thank you.